Welcome. My name is Dr. Joshua Malley. I'm a board-certified ophthalmologist and vitreoretinal surgeon. I'm also the founder and CEO of Malley Enterprises. And I serve as the Retina Medical Director of the Macular Degeneration Association. It's great to have you back for another episode of the Retina Project. And in today's episode, we're going to talk about treatment options in retinal vein occlusion. As you know from my prior episode, we were discussing how to talk to a retinal vein occlusion patient. I think RVO is one of those diagnoses that sort of goes a little bit under the radar a little bit among retina specialists. Certainly AMD and diabetic macular edema are probably our top two diagnoses that we see, but certainly I think retinal vein occlusion affects a good proportion of our patients and should be talked about at great length. So I'd like to talk to you today about treatment options for retinal vein occlusion patients that hopefully should help to serve as additional guidelines for retinal specialists out there and some good best practices. So the first thing we want to talk about is, what are we actually treating with retinal vein occlusion patients? And really, I think there's just really three main categories that we talk about here. The first one is treating macular edema. The second one is treating neovascularization. And the third one is actually getting a systemic workup on that RVO patient. So let's talk about macular edema first. So I divide it up into two major categories of treatments. Obviously, anti-VEGF treatment is our mainstay, is our first line treatment, and that includes Eylea, Lucentis, and Avastin. Of note, Avastin is not FDA approved for the treatment of RVO. However, is still used by clinicians in practices across the country. And the second class of treatment options that we have for patients are steroids. Most importantly, Ozurdex, which is FDA approved for the treatment of macular edema following a vein occlusion. And then finally, as I know, those are two key categories, but really there's actually, I feel like a third category, which I would say is combination treatment and combination with anti-VEGF and steroid on board as well. So kind of having both treatments on board. So I think that's one major misconception, is that patients need to be either treated with anti-VEGFs or need to be treated with steroids. I think you can actually, in some cases I use both. I actually use a combination treatment algorithm as well for certain cases. So I think that's kind of a key caveat there. As well as, again, I think most retina specialists, including myself, treat patients with a treat and extend protocol, and that seems to be working with the most effectiveness to bring the best possible outcome to patients while minimizing injection burden on these patients. Now, the second category that we're treating is neovascularization. As we know, with retinal vein occlusions, especially with CRVO in particular, the risk of neovascularization is present. For me, I think it's really important to get a nice wide field angiography in order to locate areas of ischemia and the need for neovascularization. And then with that, treatment-wise, again, we have the anti-VEGF category, Eylea, Lucentis, and Avastin, and also panretinal photocoagulation, or PRP. Those are the two major classes of treatments. And again, I kind of throw in a little third one there in the sense of a combination treatment. I have patients that I treat with PRP as well as submental anti-VEGF, and I think that's been pretty helpful in treating pretty aggressive neovascularization with the anti-VEGF component, treating the short-term treatment, and then the PRP laser, adding that long-term effectiveness with regressing neovascularization for the long term. And now finally, the third thing that we should focus on as retina specialists and eye care professionals when we see RVO patients is the systemic workup. And again, this sometimes gets a little bit overlooked, but I think it's so important in clinical practice to make sure the patients are hooked up with their primary care doctor and get that workup whenever we diagnose the retinal vein occlusion. So that includes checking blood pressure, getting hemoglobin A1C, cholesterol levels, and then most importantly, especially for CRVO patients, getting that carotid ultrasound I think is really critical. And then again, if you have some unusual case, a younger patient, unusual case, unclear etiology, I also like to get a hypercoagulable workup as well in these patients. So those are my keys for the treatment options in patients with retinal vein occlusions. Thanks again for joining me on the Retina Project. I'll see you next time.